You're watching Fox in the Morning with Mark Bailey, Linda Martin, and Chrissy Russo. Your station for balanced news.
Okay, it's about time to break out the shorts and skirts. I know what you're saying here. My legs aren't ready. But before you panic, we've got a way to help you get your legs beach ready when Fox in the Morning continues.
It's about time to get your legs ready for the summer, and for some it's not so easy, especially when you're dealing with varicose or spider veins. But now there are easier ways to treat diseased veins with fewer risks and less downtime. That's what we like to hear. Dr. Brent Greenberg joins us from the Chronic Vein Treatment Center, and thanks so much for joining us this morning. So how big of a problem is this out there for people?
Well, vein disease is actually very huge. It's actually more common than diabetes. Over 40% of women and as much as 25% of men actually do have vein problems and don't even realize it or can see on their legs that they do have a vein problem.
Yeah, you know, I was reading that 1 out of 3 Americans over 45 has some kind of vein disease. Is
That's
that right?
true, and because of the fact that they don't realize that they have symptoms that are often due to vein disease, many people walking around not realizing that they actually do have a problem that can lead to other problems down the road.
What causes it?
Well, vein disease, the most common cause is hereditary, and we actually have a saying in our office that, you know, you got a lot of great features from your parents, but your veins are probably not one of them. And over 50% of the time, if one of your parents has veins, then you're going to get them. And if both parents have veins, you're definitely going to get them 100% of the time. But other causes can be due to pregnancy, can be due to jobs where you stand for long periods of time. For people who are servers or flight attendants or people who sit for prolonged periods like TV anchors or anybody who sits at a desk. Actually, all of those things cause blood pooling in the legs. That pooling is what causes these veins to get large and develop the varicosities that we see on big legs.
Yeah, we were just listing the warning signs. So can we throw those up there again one more time? I don't know if they can do that, but just there was several warning signs to say.
Yeah, well, you know, tired, heavy feeling legs, especially towards the end of the day, pain if you've been sitting or standing for long periods of time, sort of that achy dullness, swollen ankles is a common sign, or if you start seeing pigmentation, discoloration, or breakouts around your ankles. And then people, especially during pregnancies, they'll start to see a lot of enlargement of veins, and it's actually due to hormonal changes, not due to weight, that causes this.
Yeah, it's really not a pretty thing. I mean, it's great to be pregnant. It's wonderful to have kids, but...
Well, we push every woman who, the moment they find out they're pregnant, the first thing they do is get their compression stockings on. The next thing they do is tell their family that they're pregnant. Because the moment you get started on it, you can actually reduce the risk of developing these veins down the road.
Okay, so we have some before and after pictures, too, of treatments, because the treatments are much faster and not quite so invasive as they used to be.
They're so much better now, especially in the last 5 to 6 years. We've had such an improvement in the technology. And these are before and afters from our own office. And this is a treatment that we do called endovenous laser treatment. And instead of the old vein stripping technique where we used to have people go into the hospital and they would be in for several days and they had about a 40% chance of recurrence, now we have a technology where you can come into an outpatient office under a nearly painless procedure and leave that office, walk for half an hour, and go back to work the next day and have legs that look like this. After about 4 weeks is what this will look like.
That's amazing, the difference, and to think that it's that fast. Now, we also have some other pictures, I guess, of some of the different problems. These are spider veins.
So these are common spider veins, and this is what most people will see, especially women on the outer thighs is a very common area, but these spider veins can pop up anywhere, and over 80% of the time, these veins will actually cause symptoms, especially people who complain of restless leg symptoms at night. These are varicose veins. This results from deeper system problems under the legs. So we always do ultrasounds to make sure we can find the source of that.
So when should people decide to go in and get some help on this? I mean, because by some of the pictures, it looks like they waited a long time to come in.
Some of those people, right. When you start seeing, especially when you start seeing things down by the ankle, that's an example where this is a chronic process, and one of the treatments we do is something called sclerotherapy, where we inject medication in these veins. But we always recommend people come in for an exam first, especially with an ultrasound. And this is an example of phlebitis and inflammation of a vein. You come and get the ultrasound because frequently the source of the problem is coming deep to the skin. It's not actually what you see on the surface. So we don't want to do any treatment. And that's the long-term process, and that's called an ulcer. That's what happens when veins are not treated over time and eventually break down the skin.
Because they're just not working.
Right. These veins no longer function anymore, and so they're causing problems. We can actually fix this and can go back to a normal, healthy leg and feel better, more importantly.
And so if you have a family history of this and you know it's in your family, is there any way to prevent it?
Well, prevention-wise, no. This is sort of like going to the dentist. You floss every day and you brush your teeth, but you still need to go from time to time because things happen. And with vein disease, although we can fix what we see, there will be problems down the road. But fortunately, that it took you this long to get your legs where they are now, it won't take that many years for all these things to continue going on. So it actually spreads out. But the treatments are better than ever.
Okay. All right, Dr. Greenberg, thanks so much for being here.
Thank you for having me.
All right, we'll have more information linked to our website at fox6.com.